At present, we're hearing lots of reports of different difficulties and presentations as children and families move from the lockdown stage to a stage of increased socialisation. What we have just been through is unprecedented. We have never before lived in a time where children have been forced to stay away from school and interact only with those in their home. There have been lots of positives reported during the lockdown stage, but also many challenges. But the move from lockdown to a new stage of socialisation also brings about a new set of challenges. Parents are reporting a number of difficulties, such as children presenting as shy, clingy, unable to speak in the company of others, children refusing to leave their home or their family, being behavioural when out with other people, being very emotional or tearful, or presenting as extremely shy or cranky or tired. We have no research and no norms to go by to figure out what should be happening for children in this situation. But what we do know is there's absolutely nothing surprising about any of these emotions or reactions. Children have been told for many months that they are not allowed and unable to interact with other people. And now, although excited about the prospect of being able to do so, it is also very challenging, confusing and overwhelming for many children and families. So understanding what is going on is key, and the what is different for every person. It's also very important to check in ourselves with how we are feeling. Are we apprehensive or scared or worried about the move from lockdown to this phase of increased socialisation? Is this time potentially triggering of a past event you might have been through? So maybe you left hospital at one point with a child and you're worried about them picking up an infection. All of these things are important to know and reflect on so that we can make decisions about how best to express these feelings, as otherwise we might be expressing them with our children without our knowledge. It would also be very, very normal for any adult to feel a little bit scared or apprehensive about this move. So talking to other friends and families can be very helpful in terms of getting a sense of what other people are feeling as well. The second thing to do is to understand what might be happening for your child. And as I said a few minutes ago, the what is different for every child. So what strengths and difficulties does your child have that might help or hinder this particular transition? For all children, the situations they're currently facing into are much more demanding socially, cognitively, physically, and in terms of communication than they were during the lockdown phase. So we would expect to see significant tiredness and what we call dysregulation, or that feeling of the system becoming overwhelmed. For children with additional needs, such as learning disabilities, physical disabilities, sensory processing difficulties, autism, to name but a few, additional challenges are expected, and so that dysregulation is expected to be greater. For example, if your child does have some sensory needs, the lockdown phase might have been a welcome break from all the social, cognitive, sensory demands that they might have experienced during school, for example. So going back into those busy environments might become very overwhelming and lead to significant tiredness and dysregulation in that child. Similarly, if your child is quite shy, interacting again with family and extended family might be quite a challenge for them, which might lead then to some behavioural problems, tiredness, or them feeling overwhelmed. Adapting to any new environment takes time and patience, not just for the children, but also for the adults. So preparation is key to ease any anxiety and reduce distress. So using whatever communication method you would normally use, that could be a visual schedule, that could be just a conversation, a social story, and using that method, explain to the child what will happen and when it will happen. Gather as much information as possible. So if you're going to a medical appointment, if you're going to July Provision, if you're going to some summer camps, find out as much information as possible about who you will be meeting and also what they might be wearing. So are they going to be wearing masks? Are they going to be wearing visors? Are they going to be wearing PPE or that protective wear? Once you have that information, you can pass that information on to the child. Even if you're meeting with friends, find out what's expected of the child and of the adults. So will the adults be socially distancing and the children be allowed play in small play pods? All of this information, when communicated to the child, could provide more clarity and therefore ease any distress or anxiety. Practical things like making sure they're well fed and also bringing lots of snacks with you can avoid any dysregulation from hunger. Similarly, making sure that they are well rested, so early to bed the night before, and if they need their naps, making sure that they have their naps before you are going to venture on this journey with them. After the interaction, make sure that they have sufficient downtime. And what I mean by that is downtime is a time that allows for minimal demands on the child. So not many questions, just minimal demands. Allowing the child to relax and unwind, things like reading a book, maybe watching some TV, sitting in a beanbag, playing alone if that helps, relaxing on the couch, cuddles, cups of hot chocolate, anything that provides comfort and support. We don't want to be worried about bad habits at this stage because this is just short term. If they are upset, simply just being with them can be enough to regulate them rather than asking too many questions. So once they do calm down, you can then talk to them about how they are feeling, if appropriate for their age and understanding. Another thing that you could do is model how you were feeling. So if you did feel a little bit uneasy or a little bit apprehensive about something, saying that to your child. So I felt a little bit scared when I saw my Auntie Mary wearing the mask, but I know it's just something that she uses to help her stay healthy and stay safe. How did you feel? Lastly, it's very important to take small steps. So things like meeting in small groups for shorter times and work up from there. With anything new and a little scary for any child or adult, it's important to take baby steps, as doing too much too soon can be overwhelming and therefore lead to it being more of a challenge than it needs to be.